Hi, this is Dr. Ange, and today I'm going to talk about what the difference is between situational crisis and acute mental illness. So I just want to share the disclaimer. Even though I am Dr. Ange, I am not actually a qualified doctor. What I do have is over 30 years personal experience with mental health issues, and I also work as a peer worker. So peer workers are hired because of their lived experience, especially in mental health. And so I work with people who are struggling with mental health issues, and I offer them support, encouragement, and hope that recovery is possible. Okay, getting back to the topic for today, situational crisis and acute mental illness. What's the difference? Now, I'm going to be putting definitions up on the screen. So, situational crisis, that relates to when your life circumstances have hit a hard spot. And so it's not that you've got an ongoing mental illness, but rather you might be really stressed out, really depressed, really anxious because of what's going on in your life. So things like full-on financial trouble, either living in poverty or facing bankruptcy, or losing your job, or being in a job where you're under a lot of pressure, that could be a situational crisis that leads you to need to get some psychiatric help. Other situational crisis, things like relationships ending or toxic relationships, especially when they are with family members or friends. Pets dying, that's a hard one. Things that happen in life, there might be things that everyone else seems to cope with, really well, but when it hits you in your life, you kind of go downhill. And so a situational crisis usually is something that you can go to your GP for. GP, general practitioner in Australia. I think it's just doctor in America and maybe England. I don't know. Just your regular doctor. You'd go and have a chat, and they might say, okay, well, I want to see how you go on some medication for short term, just to get you a bit more stable, maybe to relieve some anxiety, maybe to try to pick up if you've been depressed for more than 2 weeks, I think is the official diagnosis for depression these days. But usually with medication for a situational crisis, it's a short-term dosage, or not dosage, but you're on it short term, maybe 3 to 6 months. In the same time as using meds, you might want to seek out a counsellor. Counselling is really helpful for situational crises. Sorry, it's a bit funny. So yeah, a counsellor is really good for a situational crisis because with counselling, it does tend to be cheaper than seeing a psychologist. Counselling is really good for if you have one issue you want to look at, and if you want to learn skills or coping strategies for how to deal with that issue. So say you are really stressed out about money, and you've never learned how to budget, and you've never had a long-term plan for your finances. So going to a counsellor to learn how to have better budgeting, I can't get that word out, money management skills. Going to a counsellor to learn better money management skills, maybe reading some self-help books on how to manage your income better, maybe, as well as being on medication and going to a counsellor, maybe doing, an assessment to see what kind of job skills you can learn and bring your skills up to date. It just depends on what your situation is. I sometimes get really frustrated with books on how to better manage your finances, because they usually say, oh, you need to save 20% of your income for emergencies. And I'm like, yeah, if I could save 20% of my income for emergencies, I wouldn't be living in poverty. So it depends on the person. And it depends on the book, I guess. Some books can be self-help books can be really helpful. Some do not really help. But yeah, sorry, getting back to situational crisis. yeah, situational crisis is usually something that's happening in your life that has just thrown you for six, you know? And it's something that you might take medication for, you might not. Again, it's a personal journey. I've just finished a recording on medication friend or foe, so check that out to get a better idea of issues involved with whether or not to take meds. But yeah, situational crisis is usually something that you might need help to get through, but once you get the help, once you get the support, once you learn the skills, it's not likely to come back. And also, if it's something like being stressed out about money and in part of trying to overcome that, you learn better skills, the skills that you learn will probably put you in a better headspace to deal with your finances in the future. I'm trying to think of another situation. Relationship and breakups, that's a big one. We get a lot of people come into work. Like, I work in a psychiatric ward. We get a lot of people who come in as clients to works when their relationships break up. It's really heartbreaking. Like, people might think, I don't know what people think, but from what I've seen, people can really go downhill really quickly when their heart's broken, or when the relationship they were in doesn't go the way they thought they would go. Yeah, broken hearts, pretty serious stuff. So again, counseling might be a good way to get help if your relationship breaks up. Medication might help you, but usually with a relationship breakup, it hurts, and it hurts really bad for ages, but you slowly get over it. It's something that most people get over and get on with their lives and, hopefully meet somebody else. I'm 43 years old at the time of recording this. I've gotten over quite a few broken hearts, still haven't met the one. So there you go. Most people meet other people, but for some reason, Dr. Ange is still single. Why? I don't know. It's one of those life questions that I'm not sure if I'm ever going to find the right answer to. Now, I just wanted to talk about acute mental illnesses. This is kind of the other end of mental health issues. Okay, so you've got situational crisis. That's usually something that's happened in your life. It might, throw you around for a while. It might be hard to get through. You might need to get some support, friends, family, maybe medication on the short term, maybe counseling, maybe a psychologist, maybe a self-help book, maybe a support group. Just depends on what works for you. But situational crisis is something that you can work through. And if you do go on medication, it's usually only for a short time, maybe 3 to 6 months. Acute mental illness, that is more when there's a psychiatric diagnosis, and they usually say acute mental illness is caused by a chemical imbalance in the brain. They will suggest taking medication for the rest of your life if you want the condition to stabilize. And again, I've just finished a video on so acute mental illness. There's no cure for acute mental illnesses. So bipolar disorder, schizophrenia, schizoaffective disorder, OCD. There's officially, there's no cure. And this is why they say it's a long-term mental illness, or a lifelong mental illness. That said, what they also say is that there's no cure, but you can learn to manage these mental illnesses. And as I mentioned, I just finished doing a video on medication, so definitely check that out to get a better understanding of how medication comes into treatment for acute mental illnesses. But yeah, so acute mental illnesses, these are usually diagnosed. So some people might self-diagnose and then get it confirmed with their GP or a psychiatrist. Some people end up really unwell and will go into a psychiatric ward and be diagnosed during their stay. If you're really young, like say you're under 18, they might not give you a diagnosis. I don't think it's a good idea to diagnose people under 18, but they might want you to stay in contact, like with a mental health facility, just to keep an eye on you. And there are facilities for teenagers with mental health issues. But as far as that acute diagnosis, I don't think it's a good idea to diagnose people under the age of 18, because there could be a lot happening in your life. Like, there could be a lot of situations in your life that are giving you symptoms of mental illness, but that you might learn to deal with and overcome, and, you know, get on with your life and never have a mental illness issue ever again, which is the goal, you know. Yeah, that's probably a whole other topic. But often when people are, say, in their late teens, 18, 19, early 20s, for some reason, they think, again, chemical imbalance reasons, this is when a lot of symptoms for mental illness will come to the forefront. And so, you know, what usually happens, you end up really unwell, you get a diagnosis, the doctors will suggest going on medication, and then it's a whole other journey about deciding, are you going to be on medications long term? Are you going to be on medications short term? And yeah, that's a personal decision. I talk about that a lot in the medication friend or foe video, so check that out. What I do want to say with acute mental illnesses, like when I was 19, and I was told I had a bipolar disorder, they told me, you've got a mental illness, you're not going to be able to work, you're not going to be able to study, you're going to be on medication for the rest of your life, and because you're on medication, you won't have kids because you can't risk being off medication, because the very moment you stop medication, you're going to be in and out of psychiatric hospitals. And even the day that I left the psychiatric hospital when I was 19, there was a male nurse holding the door open, and I was really happy to be leaving. I was so happy to get out of there. And the male nurse said, "You'll be back. I give you 2 years and you'll be back." And it was such a nasty thing to say. Now, this is 20 years ago. I hope and pray there are not nurses out there working in mental health these days, because it was just such a nasty thing to say. But unfortunately, not only was what you were told 20 years ago if you had an acute mental illness, I saw it with a lot of friends who had mental illnesses. I saw them in and out of psychiatric wards or hospitals. And some of it, I guess, was because they were using recreational drugs. Some of it is because they would be on and off their meds. And, some tragic situations, people had gone through a lot of trauma, as well as having a diagnosis of like schizophrenia. And maybe they never got the help they needed for the trauma. Maybe they were just burdened with the mental illness diagnosis without really giving themselves a chance to get help for trauma or things they had gone through. So coming back to acute mental illnesses, that's something I really want to encourage people that, okay, yes, medication is an option, okay, but there's a lot of stuff that you can do as well as take a medication, or as an alternative to taking medication, to help yourself. So, things like if you have depression, there's things like different types of therapy. The one that helped me a lot was called cognitive behavioral therapy, CBT. That was life-changing for me. And then later, when I got diagnosed with post-traumatic stress disorder, I tried a treatment called EMDR. I will be doing separate videos on those types of treatments. A lot of people with mental health issues find it beneficial to do mindfulness or meditation, having a really good routine, so sleep routine, exercise routine, eating healthy, giving yourself time to rest, giving yourself time to spend with friends, and also if you have pets, pets are amazing. These are all things that can help. Um, if you have mental health issues or acute mental illnesses, um, medication helps a lot, but it's always beneficial to look into other ways of coping with your illness, because it is a long-term situation, and the more you can learn to help yourself, the better off you'll be. When I was, in my early 20s, um, I had a lot of friends who had acute mental illnesses. I had a few friends who were schizophrenic. Actually, most of them were schizophrenic. And because of the way things were back then, they gave up. They were on a disability pension. They'd be in and out of psychiatric hospitals. They never really got a chance to um, overcome their condition or overcome the limitations of their conditions. And it was heartbreaking. Like, I haven't seen most of them for years. Like, usually I would bump into people like in our main city. So every few years I'd bump into one of them and see how they're going. But probably in the last 10 years, I haven't seen most of them. And, it makes me think, well, maybe they've passed away, because it's what it was like. I did have a few friends who had mental illnesses who committed suicide when I was in my early 20s as well. And yeah, it was just horrible. Back then, the system didn't offer much hope. I don't even think anyone said the word recovery or that mental health is a journey. It was like, you've got a mental illness and that's it. This is what the rest of your life's going to be. I'm living proof that that's not the case. And I work with other peer workers who are living proof that you can have a mental illness and still get on with your life. You can still work, you can study, you can travel, you can have relationships, you can have life experiences, you can be creative, you can be awesome. Having an acute mental illness does not mean you don't get to have an amazing life. But it does mean taking the time to figure out what you need to do to function at your best. I am going to be doing a separate video about what does mental well-being look like. What does mental well-being look like? I think I said it right that time. And we're going to talk about what it looks like for different people, because as I always say, mental health is a journey, not a destination. I hope you're all traveling well. Please click like, hit subscribe, check out my details for Patreon, my Facebook page. If you'd like me to do an animation of your mental health journey, send me an email and I'll get back to you. And yeah, I hope you're all well. Take care.